how to prevent breast implant capsular contracture after your breast augmentation surgery. Let's talk to real patients in this video. Let's go. Hey everybody, Tim White, clinical specialist. I am here today with a former patient of ours, Rita, who has been kind enough to join us here to talk about her experience of preventing breast implant capsular contracture. Rita, how you doing?
Doing good. Thank you for having me, Tim.
Thanks for joining us. It's weird to come on video and talk about personal things and talk about your breast, but it's so important because there's lots of people, women and men, who have augmentation, cosmetic or other, and go through these things and they don't know their solutions. So thanks for joining us.
Thank you.
Awesome.
My pleasure.
So let's talk about Rita's experience. So Rita had a previous breast augmentation years and years and years ago. Due to the age of the implant, she wanted to exchange her implants because they were older and you just kind of prophylactically wanted to change them. And you found out about our program that we offer a prevention treatment because you were aware of all the risks of, hematoma, seroma infection, scarring, and capsular contracture. So you reach out to us and basically said, I want the kitchen sink thrown at me to make sure that after my surgery everything goes great and I reduce complications. So
Exactly.
that is exactly what you did.
Exactly.
So in full clarity, Rita has never had a history of contracture, but patients who have a history of contracture, this type of prevention is even more important. Rita chose to do it just because you wanted to be as proactive as possible.
Exactly.
Perfect. So let's talk about it. So you had your revision, you had the new implants put in, you received treatment here with us. The goal, again, preventing certain complications. Let's talk about the most important component of prevention, which is preventing capsular contracture. So today you are 1 year post-op. I think you're a little over a year, right?
A little bit over a year.
Over a year, okay.
Yes.
So we're doing a 1 year follow-up with Rita. No contracture, no firmness, no unevenness. Everything looks great, feels great, no issues, right? All right, perfect. So let's tell everybody the number one thing that we're trying to prevent with a contracture is when the implant goes in, the capsule forms. All patients with foreign bodies create a capsule, and this capsule is the root of all evil. So we did a treatment utilizing the Aspen protocol in which we use our proprietary ultrasound device that we place over the patient's breast in combination with certain medications, massages, bandages, and all kinds of other stuff to basically be able to prevent the body's immune system, bacteria, and other from entering into the capsule and triggering that hard, tight, awkward, uneven capsular contracture look. So for you, we didn't deal with any of that because everything looks great and feels great, right?
It is, and I was telling you that I feel and it looks even better than the first time that I had it. So it wasn't painful at all, and I feel great. So
Beautiful.
Thank you.
So your first surgery you had, obviously you recovered. There was, some sort of discomfort, recovery, healing. Comparatively, doing the prevention treatment gave you the additional bonus of not only preventing complications, but you feel like you got better, faster, less pain, and kind of crossed the finish line.
100%. 100%. The first time was super painful.
Mm-hmm.
I don't have an idea why I did it the second time, but I have to. And I don't regret it at all. I feel great. As I tell you, it's not painful at all.
Mm-hmm.
And it looks even better than the first time that I did it.
Beautiful.
So
that is the goal of post-operative rehab. So this applies literally to every single thing in our lives. Mm-hmm. So as a licensed physical therapist, patients who have hip replacements, knee surgeries, back and neck surgery, there is not a physician on the planet that does not prescribe an after-surgery program and just abandons them and says, hey, you had surgery. It creates so many complications. So just like patients who have those type of surgeries get out, we now have a post-operative recovery program for not only breast, but liposuction, facelift, tummy tuck, with the goal of prevent problems and speed up healing and recovery, and for you, even a better result faster right after surgery.
Exactly.
So for everybody watching, prevention starts at 2 to 3 weeks post-op. So you had your surgery. We already had you in the books on the schedule. We started roughly about 2 weeks after surgery. We connected with your surgeon, prescribed the medications that we needed, got started with the ultrasound, the hands-on, the massaging, and the garments and some of the other home program stuff that we gave you. And basically the program was 1 a week for 5 weeks. So for Rita's program and most everybody's program, it is a once a week for 5 weeks, and assuming everything looks and feels great in that 5 weeks, basically we cut you loose and call us if you need us. Hopefully you don't need us. For patients who are out of towners, because you're local here to us in our Coral Springs, Florida location, for patients who are out of towners, we also offer a fast track. So those programs are a 5-day back-to-back course where patients can fly into town, do the program for 5 days, fly home, and then you'll get another 30 days of your own program, again, to help prevent issues. So again, for Rita, she didn't have contracture, but she wanted to do everything she possibly could, and now here she is 1 year later. Looks great, feels great. She's very happy. Especially important, though, for anybody watching this that has a history of capsular contracture. So if at any point in your path with a breast implant that you had the higher, harder, firmer, tighter, painful implant, you more so than anybody are the prime candidate for our prevention program. So please do consider that. And really anybody who's looking for plastic or cosmetic surgery, facelift, tummy tuck, liposuction, we offer a 2 to 3 week post-op course in which lymphatic drainage, external ultrasound, massages, post-op recovery type of techniques and things, including managing garments, is offered. So even if it's not breast related, take a look at the banner below, hit us up on the 877 number, send us a message. We do offer virtual evaluations, so even if you are not near us, we can talk to you online at any time, walk you through the process, and even if we're not the solution for you, can prescribe to you a alternate solution to help you out in that effect. So Rita, thanks for participating with us here today. Thanks for joining us and helping other patients potentially out there learn about the Aspen program.
Thank you for having me, team.
Awesome.